Revenue featuring Magnolia Regional Health Center. I wanted to start off today with a few housekeeping items. Both of our speakers want this to be a very interactive session, so I wanted to let you know that you can ask questions throughout the presentation by typing them directly into the chat section of the control panel. We will answer as many questions as we have time for at the end of today's presentation. If for some reason, however, we aren't able to get to your question, one of our presenters will reach out to you directly following the webinar. Now I'd like to introduce today's speakers. We are very pleased that Hannah Bascomb, Patient Access Supervisor at Magnolia Regional Health Center, was able to join us today. Hannah began her career with Magnolia Regional Health Center in 2015. Since then, she has quickly advanced her career. She began as a registration clerk in the emergency department, then served as a patient access quality analyst, and now her current position is patient access supervisor. Hannah has been instrumental in helping install new technology for the patient access team, working on the implementations for both Meditech 6.1 and the full suite of the AccuReg front-end solutions. Hannah has earned many awards for her outstanding contributions at Magnolia, including department awards as the Employee of the Month and Employee of the Year, as well as the Hospital Employee of the Month, and she is currently serving as the Hospital Employee of the Year. Hannah, would you like to say hello? Also joining us today is Darlene Wixon. Darlene is the Director of Pre-Registration Services at AccuReg. Darlene has more than 20 years of healthcare experience, with half of those dedicated entirely to patient access. Prior to joining AccuReg in 2013, Darlene was the Patient Access Director for Singing River Hospital, overseeing 2 hospitals, 2 freestanding diagnostic imaging centers, and numerous clinics. During her career, she has managed a patient access team while simultaneously managing an 18-month implementation for an Epic ER. She also has experience creating a centralized scheduling process, overseeing a pre-registration team for the ER and the outpatient surgery, and providing financial counseling for patients. Darlene is also an active member of NAHAM. She has been a speaker at both the state and the national levels, and was the co-founder of the Mississippi affiliate of NAHAM in 2007. Please join me in welcoming today's speakers.
Good morning.
Good morning, everyone.
Good morning, Hannah, and good morning, Darlene. Now I'd like to talk about the relationship between AccuReg and Magnolia. At AccuReg, we are very pleased to have Magnolia Regional Health Center as a client and have them join us today to share their journey in implementing a point-of-service collections program beginning in November of 2016. In addition to using our Patient Concierge services, Magnolia also uses the AccuReg full suite of front-end solutions for its internal team of 45 patient access staff, which is responsible for the outpatient, ED, and surgical daycare patients. Today, Hannah and Darlene will tell us how the AccuReg Patient Concierge team became an extension of their internal staff and helping meet their goals of creating a better patient experience while increasing their revenue.
Good morning, everyone. This is Hannah. I want to start by saying Magnolia has never had a point-of-service collection process. Upfront collections were brand new to us. We are a very small community, and our hospital is also locally owned. We decided to use AccuReg Concierge team rather than using our own employees in-house, simply on the fact that our staff have never collected upfront payments. Prior to the concierge team, patients were simply billed. We found the concierge team was highly familiar and experienced in the collection process as well as the QA process. We began upfront collections in November. Our CFO, as you can see in this slide, Brian Craven, set a goal for us to collect $1 million during our first year of collections. While utilizing the concierge team, not only are we able to increase the amount of patients who are pre-registered, but we are also able to set patients' financial expectations prior to arrival.
Okay, and Hannah, let me expand on that last point that you had. When I actually went on site at Magnolia during the sales process, it was important to Brian that we be sure that we kick this off with the thought in mind that the community was not used to being asked for money. They had never had a pre-registration service, so this was totally new. And being in a small community, it was important that we did this right and that we did not let it backfire. He did not want to hear from board members and people complaining about it. So as you can probably see in a slide way down here in this presentation, we have successfully done that. But it was important that we made Magnolia's patients aware of their financial responsibility. Brian had talked about how a lot of times patients would get their bills and then be upset, and so we wanted to take care of that piece of the puzzle also. So first off this morning, let me explain exactly what concierge service means. It is a pre-registration service. We just take it a level higher. We do everything a pre-reg team would do, which is capture all the information for the account. We do the quality assurance auditing. We ensure that the account that we provide to Magnolia of our call with the patient is as correct as it can be. We also provide financial assistance to the patient. All of this is done remotely in Mobile. We are an extension of Hannah's team, but their patients have a seamless experience, as we'll talk about later. They really don't even know we're not there at Magnolia. And it's important to note that there's no capital investment here for Magnolia. They did not have to find a place for a pre-reg team. They didn't have to buy the equipment, didn't have to buy any of the tools that we use. They did not have to recruit, hire, or train staff. All of those are challenges for putting together a registration team, and our concierge team was put together by AccuReg. All these pieces were handled by us. Magnolia entrusted us to do this for them, and we feel like we put together a very best practice pre-registration process for them with our concierge team. So this slide is breaking down what we actually plan to do for Magnolia. We knew that we had to have people in place, we had to have systems, and we had to have processes. First off, we wanted to get a very highly experienced patient access staff, which we were able to do. One reason for that was we are based in Mobile. We have a very large labor pool here. We have a lot of hospitals, a lot of people that have the experience that we were looking for to do this work for Magnolia. So we took care of that by hiring staff that was experienced. The next thing is the tools. We actually have best-in-class technology tools that we use. We use technology so we can be more efficient. A lot of times hospitals will put together a pre-reg team, and I actually have the experience of this working in a hospital environment, that I did not have technology to eliminate labor. I had to just hire more people to do more work. But with AccuReg, we always want to do more with technology first and not necessarily with more people. We also have a phone system here that probably has more capability than most hospital PBX systems. Most pre-reg teams in the hospitals are using their phone systems off their PBX. They may not be able to record those calls, which we can do. We provide call recordings and reports to Magnolia, and I also use them. We track our quality of the calls. We track our performance. We're able to, at our disposal, know how long our calls are taking, how many calls are abandoned, how many patients are calling in, how many we're calling out, how many we're touching. So we have that advantage also. And then the last thing, which was probably the biggest challenge, was the process. And so we got with Hannah and her team, and we standardized a process that we thought would best fit their registration process. We actually looked at the physical location of where the patients come in. Hannah and them determined how their patients would flow in, and then we sat down and said, this is how each patient should be pre-registered. So we standardized the actual pre-registration process, and we always use the NAHAM best practices as a guide. And then we had transparent reporting. We all felt that it was important that Magnolia be able to know exactly how well we are doing here with their patients on any given day and time. They can pull reports just like I can see into their world, they can see into my world, and we are a team. But it's important to know that we standardized the processes for Magnolia while we were doing this.
And I would like to add, I use a lot of the reports that AccuReg provides to hold staff accountable, not only for collections, but also accuracy. And I love these reports because these allow me to monitor both Magnolia and AccuReg's team, and they're great for recognizing employees for a job well done.
Yeah, and I'd like to add to that Hannah sends my staff emails and tells them how great they're doing and pumps them up. And anytime you can give somebody good feedback, it's a great day. So this next slide is our partnership. What we did once we had our plan in place, how we actually implemented that plan. The plan only took us about 2 months to execute. I would dare anybody to try to put a pre-registration department together in 2 months, but we did it. First, we found our registrars that we needed. These folks that you see on this picture here, David and Catherine and Jessica, they have over 20 years together of registration experience. So when we got them, they knew how to talk to patients. They knew how to be warm and helpful. They were understanding of, asking the MSP questions. They knew insurance. They knew how to do coordination of benefits. All we had to do with them was actually teach them the Meditech system at Magnolia. And for that, we took them on site. It was good to take them on site because they were able to physically walk through the process where the patients would be coming in. We gave them mats. We trained them. Hannah actually puts her staff through 3 days of training. And after 1 day, Hannah came to me and said, they're trained. They know it. So we were kind of excited that we were able to get that done in a third of the time. While we were there, we got the IT access completed while we were on site since we were going to be working remote. And then we spent about 2 weeks after that going through a checklist. And this was where we were developing the process that we were going to use. And we worked with Hannah and her group so that we could have good handoffs of patient accounts from our staff to her staff, a good feel for the best way to handle the patient on the day of service, because we wanted to avoid any duplication of services. That's one of the main complaints that you'll hear from patients when they pre-reg with a pre-reg team, and then the day of service when they come on site. As much as you want to prevent it, a registrar, when they sit down in their booth, invariably, out of habit, they may go through the whole process again. And so we wanted to be sure that we avoided those things like that. So when we did the Go Live, which was November the 1st, and Go Live was the day that our team here in Mobile actually began calling their patients for the following week. So Hannah and her group were here. They sat and listened. We developed and tweaked the scripting. We provided feedback to the staff, especially using the Meditech system. And once we knew that we had everything right, a couple of days, they went back to their hospital, and then they were there, Hannah and her group were there on site when those first few patients started coming through. So it was important that they got to see the process from our end when it started, and then the process when the patients were coming through, because not only were we doing something new, but Hannah's staff was doing something new in bringing their patients through a fast-track registration. Okay, next slide. I want to take some time and talk about the actual process that we're using. So this first bullet point that's going to come up is the facility scheduling. Magnolia has a centralized scheduling department, and we receive their scheduling feed. And from that scheduling feed, we look at all their outpatient and same-day surgery patients. We call all patients, regardless if they have an estimate or a balance, It's our focus to speak with every patient and give them an opportunity to be able to go through the fast track when they get to the hospital. This next point is we look at the account in their Meditech system. We verify the insurance. The system automatically does that. We look at how it comes back. We look to see if we need to ask the MSP questionnaire. We correct any account issues that we find that may have come over from the last visit. And we look at the demographics. We get familiar with the patient's account before we make that phone call. And then we make that phone call to the patient. We reach out to the patient, and we, as Hannah will tell you later, there's certain things that we say to the patient. But we gather the information from the patient, and oftentimes information may change once you get on the phone with the patient. So once we put an information in that's different, our QA system is going to actually go back around and audit it, and then we're going to be able to get that corrected and updated with the patient. Perhaps their insurance has changed or something like that. That's why there's a double error here, because all that kind of works together in tandem on the phone call. The other thing that we talked about is we do record the phone calls for quality. I know it would be wonderful if, as a patient access director, I could have recorded the conversations in the booth with patients to know that things were being done properly in the way I wanted them done. But we do have that ability in the pre-registration process with the phone calls being recorded, and then we can listen to them for quality. And then, of course, we ask the patient if they have any other questions, and we try to take care of any needs that they may have on that phone call. Of course, at the end of the phone call, we go over the benefits of the patient, and if there is an estimate on that account that has fired, we provide them with that estimate. And then we offer them the discounts that Magnolia has put into place. They've got some very good discounts that they're offering to encourage their patients to take advantage of the point-of-service payments. And then we can set up payment plans. If a patient cannot take advantage of that, they do offer a payment plan. And then we have the ability to collect and process that payment all in the same screen. All of this happens in one screen for our pre-reg registrar. And then we can update the hospital ADT system, which is the Meditech system. And again, this is a dual error, because while we're on the phone and we're talking to them about their payment and everything, we do go back into their ADT system, their Meditech system, and we update it. And then the last step here is the actual arrival of the patient when they get to Magnolia. Hannah will talk to you about that in a little bit, but we're excited to know that it has emptied their waiting rooms. They have actually, I think, Hannah, you told me there was a story about one patient looked at another patient and said, "How did you get to go through so fast?"
Yes, yes.
Yeah. Right. You know, a patient sitting there, they've been told to sit and wait, and the other patient walks on through, they're going to want to know why. But we also have the ability, we flag accounts. We have a process with Magnolia that we designate accounts so they're flagged with a certain number to know that there are certain issues or there are certain things that require that patient. Even though we spoke with them, we handled everything we could, there are some things that require them to actually go back into the booth. Sometimes it's just presenting an ID that's not on file, or a new insurance card, or perhaps they could not pay, could not take advantage of a payment plan, but they had other financial counseling that needed to be done. So this is the process that we take, and really maybe 5 to 7 minutes on a phone call with a patient. I've seen 3-minute phone calls that complete an account with this process, and I've seen some even with the MSP or patients not sure of the estimates or having to have their benefits explained to them. And one thing I want to add, a lot of times this is an opportunity for us to actually explain to a patient what a copay is, what a deductible is, what a co-insurance is, that they've never had anyone tell them or explain that to them.
So we knew during the beginning that calls from an unknown number could confuse patients as to whom was calling them. AccuReg provided Dion Henry, our VP of Financial Services, the ability to be able to personalize the welcome call that patients first hear when calling the concierge service. And we did this to ensure patients would hear a voice they were familiar with. AccuReg's concierge team provides us with accurate and complete registrations on all patients. Like Darlene has mentioned, they are very familiar with our system. Not to knock on any of our employees, but they're great. I mean, they really know what they're doing. Instead of a patient finding out their cost of care upon arrival, the concierge team is able to set financial expectations earlier. We also created a system to where if a patient is pre-registered over the phone, they will be expedited throughout our registration process, and I'm going to speak a little more on this later on. AccuReg prides on registering patients at their convenience. The very first question a patient's going to hear whenever they answer the phone is this a good time for you? We have learned that most patients prefer to be pre-registered over the phone rather than in a booth. The concierge team not only provides the patient with their financial responsibility, they also help assist the patient with directions so a patient knows where they need to go once they arrive to our hospital. And they also help with scheduling information. If a patient needs to reschedule an appointment for any reason, the concierge service provides the patient with the contact information they need in order to reschedule their appointment. And if any other questions arise between the concierge team and the patient, the concierge team works directly with our staff at Magnolia. And as I've stated before, AccuReg provides us with accurate and complete registrations on all patients. AccuReg is fully aware and capable of working with our system, which is Meditech 6.1. The concierge team verifies all patient demographics, insurance, as well as coordination of benefits. Prior to go live, Magnolia and AccuReg work together to provide scripting to all staff regarding the collection process. Not only does the concierge team utilize this scripting, Magnolia staff uses the same scripting. AccuReg records every conversation between the patient and the concierge team, and we're able to request or listen to any conversation between the patient and the concierge team at any time. And this helps reassure us that appropriate scripting is being used at all times. And I'm sure we have a lot of people who call and the patients thought their appointment was at this time or they were to pay this amount. And these calls just help us hold people accountable. But what we have learned is that 90% of the time, AccuReg is really just doing their job. I mean, they're not the ones in the wrong. The AccuReg concierge team attempts to contact all patients 3 days out prior to their appointment. After a patient has been contacted, not only are they fully aware of their cost of care, but this allows them time to make financial arrangements if needed prior to their appointment. If a patient is unable to pay over the phone, we have other options available for the patient, such as payment plans or promise to pay. Promise to pay means the patient has agreed to pay the date of service upon arrival. While using the concierge team, we've noticed a reduce in the amount of patients rescheduling their appointments. And after receiving so much positive feedback from our concierge team, our marketing director, Ben Tucker, created this flyer, as you can see on this slide. And this flyer, it contains the concierge team's information on it. So if a patient wishes to be pre-registered over the phone, we have that option that allows them to contact them directly. We have just placed these flyers out in all of our clinics in our scheduling department. So when patients do see that they're being expedited throughout the registration process, we can hand them a flyer and they know who they can get in touch with to be that patient. When calling patients to be pre-registered, we ensure patients that they will be expedited throughout our registration process once they have been pre-registered. This allows patients to be processed throughout the hospital in a timely manner. Patients are able to go directly into treatment rather than wait in the lobby for the next available registration clerk. Since Go Live, we've seen a major increase in our Press Ganey scores. As you can see on this slide, the concierge team has also been mentioned several times in our survey since we have began the upfront collection process. And I just want to take a minute to say it is a huge deal to have the concierge team mentioned in our surveys, since technically they're speaking to these patients over the phone. They're not sitting directly in front of them having face-to-face conversations. So, of course, we love to get our scores back and the concierge teams mentioned, and they're usually, you can always count on them to be on there numerous times. So we know they're doing their job correctly. Our goal is to collect a payment from every pre-registered patient that has a balance due. This includes co-pays, deductibles, and co-insurance. And while using AccuReg, we're able to improve revenue as well as reduce costs. Once the patient has paid up front, we have mnemonics set up in our Meditech system that we add to their insurance, and this keeps patients from receiving additional bills. One other thing I would like to point out is prior to AccuReg, we were planning on replacing several of our employees due to retirement. And since we are now using AccuReg, we no longer need to replace those employees because we have our concierge team pre-registering a lot of our patients. So this is one of the other good things that we've got. And on this slide, I'm going to talk about AccuReg provides Magnolia with automated payment estimates. Our outpatient department is normally very busy throughout the week, and AccuReg makes the upfront collection process stress-free by providing accurate estimates within seconds as well as no delays for the patient. As you can see here, we're also able to provide patients with a detailed summary receipt at their request. And we have learned that it's much cheaper to collect upfront rather than after service. And I'm going to let Darlene speak a little more to you regarding this slide.
Okay, that last point there talks about our estimation accuracy guarantee. Whenever you're collecting from patients on an estimate, there's chances of either having an overpayment, which results in refunds out of your business office. And I actually, while I was a director, we went through a phase of that in my hospital where we over-collected, and then we got fussed at because we were putting too much work on the back end. And then there's also the under-collection, which can be a problem for Magnolia because Magnolia has decided, Brian Craven, their CFO, if the patient agrees to pay at time of service on that estimate in full, then they will not bill that patient. So it's important that we capture a correct estimate, very much so. And AccuReg offers this estimation accuracy guarantee, which is the NAHIM standard that 85% of all estimates must be within 10% of the final bill. And this is something that AccuReg has because they understand the importance of it, and we know that a hospital cannot under or overestimate. So I just wanted to point that out, how big of a deal getting your estimates right is to AccuReg.
So by collecting payments up front, we are avoiding additional billing costs. As Darlene was saying, since the upfront collection process was very new to our community, Magnolia offers certain discounts for patients who are willing to pay up front. As you can see on this slide, we use a tier discount rate. We base our discounts according to the amount the patient owes. We also offer self-pay discounts for our patients, which is 40% off of the top of their bill. And we've learned it's much easier to collect up front rather than billing the patient. And one other thing I would like to point out, as Darlene had said, our CFO, Brian Craven, he did want us to honor, regardless of the estimate and how much the patient pays. Since we are a small community, we do honor those discounts and those upfront collection rates. So it's really been a big change to the community. And at first we were expecting some decrease in our surveys, but in all honesty, like, they've remained the same, and sometimes they're even higher since we have began the upfront collection process. Anytime a registration clerk fully registers a patient, a customized scripting message, which includes the estimate as well as the discount amount, is brought immediately to the registrar's attention. The great thing about this scripting is our clerks do not have to use a calculator to determine the amount the patient owes. AccuReg automatically provides that, as you can see in this slide. And I don't know about most of you, but when we began our upfront collection process and discounts, we learned that a lot of people do not know how to configure discounts, even with a calculator. So this was a lifesaver to us. Of course, we have patients whom are unable to pay the data service, and when we encounter these patients, we offer financial counseling. So this screen is where we actually process our payments. AccuReg coincides with Patient Co, so our staff can take a payment inside of AccuReg. This keeps our registration clerks from having to move back and forth between AccuReg and Patient Co. A few good things about this is we're able to see the payments that have came in that day, and this allows us to hold our staff accountable daily. And Darlene, I think you can speak a little more on this.
I can. Not only are you able to see the payments that come in through our processing tool here, but within the AccuReg tool, we provide accountability reporting for collections. AccuReg is very focused on accountability down to the registrar on the QA side, and we also do that on the collection side. Not only can you identify every account that a registrar touched, you can have a report that tells you how many of those had any collection on them, how many had an estimate, what the total estimates were, and any payments that were collected. And then we actually use the NAHAM practices, and we can calculate the collection opportunity rate for that registrar. It's important, if you're going to have a goal that you're going to reach in collections, that you keep everyone who's in front of the patient accountable for having that conversation with the patient, giving those patients an opportunity to take advantage of the discounts, and also to ensure that every patient is spoken to and every registrar understands the importance of upfront collections. All right, this slide is something that I'm very proud of. My staff, of course, started out, you can see over to the left how many accounts. In November we pre-regged, and then the increase that we went up with the volumes as we got more familiar with Meditech and we took on more and more. We actually do touch every account on a daily basis that is given to us, and we were able to maintain that 99% accuracy rate. I know as a former patient access director, I would hear staff that would whine about, I have too much work, I can't get my work done right, you're giving me too much to do. That was always an ER complaint. But this is not the ER, of course, this is pre-reg, but it's still the same thing. And this shows you that we have the ability to produce more work, and we can produce higher quality results because we use an exception-based QA tool. We don't have to worry about what we got right. We don't have to go over an account checking every field, did we get it right or not. We just do our job, and we let the system tell us what needs to be corrected, and then we go back and we get that done. It cannot be any easier than that. I just cannot enforce that enough today.
So yeah, I just want to say I love seeing the results on this graph. Keep in mind we started with no upfront collections. As you can see, in November we collected $58,000, and for February we have reached a goal of $103,000. We currently just finished our 4th month of collection while partnering with AccuReg. Of course, our yearly goal is $1 million, which we have configured to $100,000 a month. And as you can see in this graph, with the help of AccuReg, we have been able to reach our goal for the past 2 months, and hopefully we will continue to increase throughout March. One thing you can notice here, if you look at November and then you look at February, our amounts have doubled since go live, so that is tremendous. I mean, that's just great. And Darlene, I'm going to let you tell a little bit more about this graph.
Okay. The bars that you see on this graph, the blue bars, the shorter bars, are actually the payments that the concierge team is taking or the promise to pay at the point of service. But even though they may look like they've dropped a little bit, we still are speaking to every patient that has a balance that we get in touch with. But we also are providing the basis for those green bars to be as large as they are, because, as Hannah's pointed out, a promise to pay is not a blue bar for us, but a promise to pay actually falls over into that taller green bar. So every financial conversation that we have with the patients results in us setting the table for their registrar to have an easier time making that collection with them.
So next week we are set to kick off our ED collection process. We are planning on using the same estimation tool as I've showed you earlier as our outpatient department. Magnolia has decided to collect copays only in the ER. We're also going to collect a flat rate for self-pay patients. One thing I want to say is we are offering discounts in our outpatient and surgical department, but with the ER we will not be offering any discounts. AccuReg has provided us with a professional scripting to ensure the collections on all ED accounts. And we are just real excited and can't wait to begin this process in the ED. It is a big change for our small community, so we're just going to wait and see how it all goes next week.
And the last two items on this slide that I'm wanting to put in place for Magnolia is the AccuReg pre-reg checklist, which you'll see a snapshot of on the right. We have the ability to provide a list of all tasks that are required during pre-reg and registration, and if they are completed in the pre-registration process, they'll be green. If not, they'll be red. That's an indication to the registrar if they have a patient that we talk to that had something we could not complete over the phone for whatever reason, the registrar can actually skip down to that red task, take care of it, and not duplicate anything the patient went through on the phone. One other thing at the bottom there, there's a thing for notes. We can communicate between the pre-reg department and the registrar with the patient outside of their ADT system. If there's something we need to put on there, some information that they need that we're not comfortable putting actually in their Meditech system, we can put it on the notes here. And then the last point is patient survey. AccuReg has embedded in their QA tool the ability to send surveys to patients by way of text or email. This is usually there are 3 to 5 questions. They're very simple, and you ask the patient if they would like to have a survey sent. They give you their channel of communication that they prefer for that message to come, and then the results can provide us with feedback. And we're wanting to kick that off so we can get feedback from pre-registered patients. And I might note, this feedback comes a lot quicker than when you go through your Press Ganey and your Picker surveys. And so it can be very specific to what we're doing for Magnolia, and it gives us a chance to continue to improve their patient experience in the concierge/fast track process.
All right. I would like to say thank you to Hannah and Darlene. That was a wonderful presentation. And we're now going to begin answering questions. But before we do, I just want to remind you that you can still submit questions through the comments pane in your control panel. Our first question is, how are estimates properly calculated? Are your contracts uploaded into the system to pull the data for a close estimate amount? And do you have issues with over-collections due to the wrong data being pulled into that estimate generated from the AccuReg application? And I see Darlene waving her hand, so she'd like to start by trying to answer that question first.
I can. Hannah, you feel free to jump in after I finish. We actually do upload the payer contracts into our tool. We actually use payer contract. We use the eligibility that we have with Magnolia, the service we provide to them, which identifies the benefits from their insurance company. And then we calculate from the CPT code that we received on the HL7, we calculate the charges, copay, deductible, coinsurance, and out-of-pocket. And I think the second part of that question was about overpayments. Hannah, do you want to speak to that?
Yeah, we really have not seen many overpayments, and if we do, I feel like our biggest issue that we have had is we have a charge master, and some of our codes weren't updated to the correct price. So I feel like, and Darlene, tell me if I'm wrong, but I feel like sometimes that is something that we run into, or we have a $0 charge for our CPT codes, which this doesn't fall on AccuReg, it falls on Magnolia. But I feel like those are the main issues that we see.
Yes, and we also have a way to track when we're not getting a charge associated with a CPT code, which we identify that and we let Magnolia know so they can update the charge master.
Great. Our next question is also around estimates, and I think, Darlene, this one is for you, which is, what is included in your estimates? Specifically, do they include hospital charges and other allowables?
All right, let me think about that one. We do not have for physicians, although, and Hannah can speak to this, we are bringing on some of their clinics, and we will be providing estimates for them. So if it can come over in an eligibility response, then our team can map that back to the estimate. We also do surgeries, and our surgeries are based off of historical claims data that we compare to their CPT codes, and that's how we provide those estimates on surgeries.
Okay, great. Hannah, is there anything else you wanted to add to the estimates?
No, I think Darlene has got it covered. She is our estimate pro. I have a lot of faith in Darlene, and I think she understands a lot of that process better than I do.
Okay. Our next question is about a change in the process around scheduling. And the question says, do you find that 3 days out is enough time to allow for financial arrangements to be made? What is your rationale behind the 3-day out for scheduling? And I think Darlene's going to take this, and then Hannah, you can add on.
Okay.
We started with our 3-day concept just because I had 3 registrars, and the registrar that works the 3rd day out is pretty much calling the patients and making them aware of the upfront collection opportunity. And then the next 2 days are where we're actually going back over that group again, but we're taking on more accounts that are being added. We didn't talk about the fact that we are working accounts that are 24 and 48 hours out. That's how we do that. But also we're finding that a lot of patients, once we offer them the upfront discount, if they are able to, they are rescheduling their appointment so they can take care of the upfront discount. 3 days out usually should be enough time if you want to go to the credit union, or perhaps you want to go get the money another way. But my staff does say they see a lot of rescheduling, and Hannah, you can maybe be able to speak to that a little bit more.
Yes, I agree. And like Darlene said, I mean, they do contact patients 3 days out, but they also are contacting the patients that are 24 hours out. And the thing is, we have a lot of add-ons here as well, so they don't get to contact those patients. So really, I mean, they're doing the majority of our scheduled patients today. And I'm not sure who created the 3-day rule. I think it was our VP. So, but I feel like it works. And like Darlene said, if it isn't feasible for the patient, then they will call or they will get their appointment rescheduled to make other arrangements.
Okay, wonderful. One of the points, Hannah and Darlene, that you made during the presentation was around providing financial assistance to patients. This question asks, how does the financial assistance module work within AccuReg? Is it part of the estimate, or is it a separate module? Darlene, you want to take that?
Well, the financial assistance, as you can see from the slides, we don't make any distinction between any different payers, whether it's Medicaid, Medicare, or self-pay. Magnolia provides a very large discount for self-pay patients to begin with before we even generate the estimate. Hannah, you could probably speak to that also, but if the patient's not able to pay, they do not refuse service, and I'll let Hannah speak to that.
Right. We do not refuse service to any patient, regardless if they can pay or if they can't pay. And what we mainly mean by financial counseling, because we are offering these huge discounts and we do set up payment plans, but we prefer our payment plans to be paid within a 12-month period. So what it really means as far as the financial counseling goes or assistance goes is we would send a patient to sit with our financial counselor. And so if they needed payment set up further out than the 12-month period, then they would be allowed to do so.
Okay, wonderful. Hannah, this question is for you. And the question is, does your pre-registration staff receive any type of incentive or commission for their collections efforts?
Yes. Well, Darlene, I don't know. You might could help on this one because we have our pre-registration team, we have our concierge team, and as far as if they have incentives, I'm not 100% sure, but our registration clerks here at Magnolia do. We haven't began doing those yet. We're going to do those every 4 months, I believe. So hopefully this month we'll have a game plan, and it may be a bonus or it may just be a luncheon, but there will be some sort of incentives for a job well done.
Wonderful. Darlene, did you want to do a follow-up?
Well, I know my staff here, we do not do incentives. We have a lot of other fun things that we do down here in our technology company, but as far as focusing on our staff's ability to make collections, no, we don't have incentives. I do know, coming out of a nonprofit hospital system, that a lot of you on the call today may have found it difficult to offer that. We were always told we could not do that because we were nonprofit. There sometimes is the ability to do it if you can get board approval. That's what I was told in my actual hospital setting, but we never quite were able to get that in place.
Okay, great. This is another question about the process, and this has to do with rescheduling patients. And the question is, do you have a deferral process or policy in place for non-compliant or non-paying patients? Hannah, do you want to start off with that?
Yeah, I guess really the main thing we do is we have financial counseling sheets. So if a patient is unwilling to pay, we provide the patient with one of those so they can call and schedule an appointment with our financial counselor. So like we've said before, we can't refuse service to anyone, so that's really the best we can do for the patient.
And Beth, let me continue with that conversation. I know that there are some hospitals that if a patient has a extremely large balance or an old balance that is due, sometimes those patients are earmarked to have conversations when they do come on site. Presently with Magnolia, we do not know of any prior balances, so every patient to us looks like a compliant patient. You know, but of course it could be very easy if we had another caller today, another hospital that was interested in using AccuReg. We could possibly put that into our process that we could identify that patient after the pre-reg call and have those conversations with them if need be. I know with Meditech, and we had a custom field that was made, and we actually have a numbering system that we put in that field after we pre-reg. So when they arrive at Hannah's desk, at her check-in desk, her staff knows how to handle that patient, whether they go here or there or who they can see. But right now, as Hannah said, every patient gets service, and if there's a need to speak with that patient, that's on Hannah's end. They take care of that.
Okay, great. Hannah, I had another question for you around financial counseling, and this is in regards to the discounts. The questions asked are discounts for all patients or just your self-pay patients?
No, our discounts are for all patients, which the only patients we are going to collect on is patients who are either self-pay or only have one insurance. We do not collect on patients that have dual coverage. But if they're self-pay, we do offer the 40% off top. But if the patient has insurance, then we base our percentage of the discount rate based on the amount the patient's going to owe.
All right, and Hannah, this question is for you. It's from a hospital that also does not have a collections process. And what they would like to know is, what is the biggest challenge or the lesson learned that Magnolia has gained in implementing their POS collections system?
Wow. Well, like I said, we're a very small community hospital. So I guess our biggest thing is when we first went live, we had a lot of fear. You know, what are the patients going to say? How is this going to go? Like, how is the community going to feel about us asking for these payments up front? And it has really been surprising. So I guess our thing is, as far as learning, would be just don't have all that fear when you go live, because it could go a whole different way for you. And we're just really impressed with the way everything's turned out. Darlene, you may have a few other things. Whenever we first started implementing the collection process, I was involved, but I wasn't involved as much as my VP. So I don't know that I can really answer that just very, very well.
Well, Hannah, I can shed some light on that. When we were in the development of this concept with y'all, there was a recommendation that you do some prior publicity with your community. And Dion, your VP of the revenue cycle, wanted to do that. She wanted to let patients know this was coming. And there were other decision makers that just felt like, no, let's just quietly start this process for whatever reason. And as you know now, we seem to have picked up a lot of energy and productivity once you got that flyer out, once patients began to see our faces, and those flyers are put in your physician's offices. So I would say one thing that anyone that's wanting to start one would do is spend at least a month ahead of time getting people aware of what was going to start, and through flyers in your physician's offices, also flyers in the booth as people come through and have registration previously, and they're going to come back in another month. That's the only thing I can think of we would have done different. Also, the other thing that comes to mind is a press release. Those of you who are considering doing this, you might want to put a press release out in your community. And I know Dion Henry, your VP, also, Dion wanted to actually take out a full-page ad, and we all kind of laughed because she was so pumped about doing this, and she wanted it to really have every chance of all the success that you've had. But it seems like we got there anyway.
We did, definitely.
That is great. Well, that concludes all the questions that we've received today, and I just wanted to thank Hannah and Darlene again for their time and for such a great webinar. We really look forward, Hannah, to hearing more about the next phase at Magnolia, and we hope that you'll be able to join us and tell us more about how you were able to implement this within your ED department.
Yes.
As a reminder to our, okay, wonderful. We're looking forward to it. And as a reminder to our attendees, directly following today's webinar, you will receive a link to the recording of the webinar presentation. Please feel free to share this with colleagues who weren't able to join us today. On behalf of AccuReg, thank you for joining us, and have a great rest of the day.